A number of years ago, I came across an article in the newspaper that a woman by the name of Esther Koenigsberg was going to start off a project to help women who suffer from postpartum disorder. Now, during the years that I practiced as a psychiatrist, I saw a fair number of cases of postpartum disorders. But I also noted that many people were totally unaware of postpartum conditions. The new mother did not realize what was happening to her. All she felt was that she was falling apart. Her husband did not realize what was happening to her. Her parents did not realize what was happening to her. And as a result, she did not get the care that she needed. And it had far-reaching effects, not only on herself and on the child, but on everyone else in the family. So when I saw that someone was going to do something to increase services to postpartum mothers, I called Esther Koenigsberg, and I told her, look, I'm retired now and I have some time. I'll be glad to help you in any way possible. And so since then, I've had a relationship with Sparks. From what I've said in the introduction, the work of Sparks is crucial because, yes, many young women are pregnant, but many young women don't realize the kinds of things that can occur during pregnancy and after. There can be prenatal anxiety. For whatever reasons, they don't have to be logical reasons. And, of course, there are postpartum problems, and postpartum problems can be extremely serious. There are mild cases, maybe you can't even call them postpartum disorders, mild cases of postpartum blues, which are quite common. They last a few days and it goes away. That is not a serious concern. But when the blues don't go away, and the woman continues to feel depressed, loss of energy, and what is probably the worst of things is loss of feelings of any kind. And the woman may complain, I don't know what's wrong with me. I don't feel for my baby. Right? So this is why education, community education, has been so terribly important. And this is one of the things that Sparks has done. In addition to providing services for the postpartum mother, is providing community educations so that everyone who's involved with a woman who's having some difficulties, right, should know what it is and not go off on a tangent, blaming one, blaming the other, or looking for magical cures, when this is a well-known medical phenomenon. The causes are generally known, although perhaps we cannot pinpoint the exact chemistry, but we know that it is due to hormonal changes that occur after the pregnancy and delivery. And it is a physical condition with psychological symptoms. Right? But that's the important thing to remember. The woman should not be considered mentally ill. It is a physical condition which happens to have psychological symptoms and can be treated very effectively. But of course, the earlier it is picked up, the less damage is done, and the more effective treatment can be. So this is why the work of Sparks is so enormously important. Let's go over to another subject now, and that is what happens when the mother is emotionally not capable of relating to the infant. That interferes with a very important process, which is called bonding. Bonding takes place between the parents and the baby, not only the mother but the father as well. And it is a natural condition where the parents show love and care for the baby. Bonding is what makes them get up in the middle of the night to take care of their baby. Right? But there are things that may interfere with the bonding. as if the mother becomes disabled emotionally and depressed, and she cannot relate to the baby properly. So with early intervention, that period can be reduced to as short as possible. Furthermore, if the mother understands what's happening to her and doesn't think of herself as terribly abnormal, right, and realizes she has a condition which is well known and which can be treated, right, she feels better enough about herself that even with her emotional problems, she can care for the baby and she can relate to the baby. Right? So, caring proper for the postpartum mother does a great deal to enable proper bonding for the baby. And studies have shown the enormous importance for bonding. And by the way, how does bonding occur? Touching, skin to skin, right? Singing to the baby, right? Reading stories to the baby. So, what are you going to read stories to a 2-week-old baby? Sing to the baby, right? Babies communicate. Right? They follow it with their eyes and they can see, right? Mimic the baby's sounds when the baby begins to coo, right? Respond to that, right? And I think that with all of these kinds of things, a relationship develops between the parents and the infant that gives the infant not only a feeling of security, which is extremely important, and is the basis for the infant developing good self-esteem, but over and above that, there are studies that show that it increases the infant's physical capacity to fight off infection, right? Bonding enhances the immune system. The work that Sparks is doing to bring the vital help to the new mother, to the husband, to the other children, because everybody is affected by a postpartum disorder, and the long-term effect of it justifies referring to Sparks' work as holy work. It really makes an enormous contribution to the welfare and health of many people. So Sparks is providing valuable services to the postpartum mother and to the family, and also community education. But this requires women power and manpower, right? This requires specialists who are familiar with the problem, and these services are costly. And there are many families who simply cannot afford the costs of such services, right? And Sparks will never deny its services because of any inability to pay, right? So a contribution to Sparks to enable for them to continue their holy work, which I think can be really referred to as pikuach nefesh, right? A life-saving work with long-term effects, I think merits the support of every individual in whichever way possible. And certainly monetary support is extremely important, because you can't run a program with the scope of Sparks without having adequate income. And as I say, many families are not in the position to afford it. So it has to be supported by the community.